Welcome, everybody, to this month's Iowa Pork Industry Center's webinar. This month, we're very pleased to have our colleagues from the Swine Medicine Education Center over on the College of Veterinary Medicine campus to kind of give us some updates on their program today. So with us, we have Doctors Justin Brown and Doctors Gabi Doughan that are going to talk to us today. Dr. Brown is an assistant professor of swine production medicine at Iowa State University in the College of Veterinary Medicine's Veterinary Diagnostic and Productional Animal Medicine Department and an instructor within the Swine Medicine Education Center. Dr. Brown earned his DVM in 2016 from the University of Georgia and joined the ISU faculty in 2019 following his time as a postdoctoral research associate with the Swine Medicine Education Center. Dr. Brown earned his PhD in 2022 in population science and animal health through the Iowa State University. Dr. Brown teaches swine medicine topics in both the undergraduate and professional curriculums, serves as the lead veterinarian for the ISU swine farms, and conducts collaborative research focused on applied projects in swine production medicine, disease ecology, and foreign animal disease preparedness and response. We also are pleased to have with us Dr. Gabi Doughan. Dr. Doughan is a postdoctoral research associate with the Swine Medicine Education Center as well. She obtained her DVM from Iowa State University in 2021. Her current position is a mix of educating veterinary students working and as well as working towards her master's and PhD and some professional practice as well. Dr. Doughan's research is focused on water biology, including identifying the composition of the biofilm and waterline disinfection methods in swine farms. So thank you very much for joining us, Dr. Brown, Dr. Doughan. For our participating audience, please feel free to put any questions that you may have in the chat, and we'll go ahead and answer those questions after Dr. Brown's and Dr. Doughan's presentation. So with that, I'm going to turn it over to Dr. Brown as he's going to kick us off here today.
Awesome. Thank you for that introduction, Dr. Rademacher. Can everybody hear me okay? Perfect. So again, thanks for that introduction. Like Dr. Rademacher said, I'm Dr. Justin Brown, and I'm one of the members of the Swine Medicine Education Center. And so I'll talk a little bit about who we are today, what we do and why we do what we do here at Iowa State in terms of swine education. And that QR code that you'll see a few times throughout my slides will take you to our link tree where there's a lot of different resources available there for you where you can get some more information as well. So here at SMEC, our goal is to really demonstrate, or rather teach, live and or digitally every clinical technique or skill in swine medicine practice and research, and provide students a place to practice those techniques. So that's our mission, is to educate people how to work with pigs, and especially veterinary students, how they can provide care for pigs as patients. And so we do that through really working pretty hard to leverage all the opportunities that we have to capture content. So you see here a few individuals working on a sow there from a research project where we were placing ear vein catheters in those sows. And so you have Dr. Anna Forseth there placing the catheter. You have a former graduate student who's helping direct the lighting, Ella Aiken, and then you have Kristen Skoland here, who's our research administrator, as well as Becky, who's another research administrator here in the college. So we're capturing that content so that we can develop resources to provide these skills to students in the future, and not necessarily have to be hands-on on pigs and have pigs as models. So talk a little bit more about those processes as we go through these slides. But this is our current team at SMEC. Some of these faces, some of you might know. Some of them might be brand new to those of you as well. So Dr. Locke Carricker is our director, and Kristen Skoland is our research administrator. myself as well, and then Dr. Jessica Bonema. She's an instructor and special projects manager for us. Dr. Gabi Doughan, who you'll hear from here in just a little bit about some of her research, is a postdoctoral research associate for us. And then Becca Walthart is a program assistant and master's graduate student within our group here at SMEC. We also have 3 work study students who are either veterinary students or undergrad students here at Iowa State. So Cora Shaw is a 3rd-year veterinary student, and then Grace and Riley are both undergraduate students that work with us and help us complete projects. And then our team is growing. Next week, we'll actually have 2 new individuals joining our team, Dr. Snezik and Dr. Moncrief, who are both 2024 graduates from their respective veterinary colleges, and then they'll be joining us as postdoctoral research associates. So that's the team that is housed here at Iowa State. And then we also collaborate with AMVC Management Services to provide opportunities for our students. So these 3 individuals facilitate that collaboration. So Dr. Josh Ellingson, Dr. Paul Thomas, and Dr. Katie Beckman. They live and work and breathe within the AMVC system, but then they allow our students opportunities to come over, shadow them, and learn from them, especially for students that want to go into swine production medicine. So like I said, we formally collaborate with AMVC. So for some of you might be familiar with AMVC, they are over in Audubon, Iowa, and they manage a large number of pigs, not only within the state, but across the U.S. And they help provide farm access for us to our students. So we at SMEC, we're not a bricks and mortar building. We don't have a farm to call our own to take students to, so we rely on those collaborations to allow our students access. And then here at Iowa State, through that collaboration, we help them with some research projects, providing them those laboratory resources and secure facilities to conduct those researches, and they help us and we help them produce the swine curriculum for our students. So SMEC, we've actually divided into kind of 2 categories, 2 sections. So we have our SMEC Learn and our SMEC Smart divisions, and I'll talk a little bit about each of these. So our SMEC Learn, or our Lifelong Education and Reference Network, is really all of those training activities that I've already briefly talked about, plus some formal courses, which I'll describe here in a minute, that we provide for undergraduate, graduate, and veterinary students. And then we also provide some additional trainings at the extension level. And then our SMEC Smart program is our swine medicine applied research team. So that's really a fee-for-service, a la carte research service where we focus on the live swine work for clients. So we can work on any and all parts of a research project, from project development through the manuscript writing and publication. But we're often asked to help provide the live animal research execution, actually go out and do the projects. And I'll give you some examples of that here in just a few minutes. So as part of our SMEC Learn project, we offer 4 different clinical rotations that are 2 weeks in duration for veterinary students, as well as international visitors and veterinarians from across the U.S. and internationally that can come and take these 2-week rotations. And the first of those is what we call SMEC 480. It's our swine production medicine clinical rotation. Participants go out, they practice clinical skills and production management skills, and experience different swine veterinary practice, and further develop those communication skills. We also have SMEC 478A, which is our swine production management and consultation rotation. That's the one that those individuals that are over in Audubon with AMVC actually lead for us. So students go over, they're integrated into AMVC management services. for 2 weeks to learn about swine production management and consulting within that organization and really understand what it's like to be a swine production veterinarian. Our 478B rotation is our clinical pharmacology, vaccinology, and treatment management rotation that we provide, again, another 2-week experience where students learn all about the therapies, so different antimicrobials, vaccines that can be used for swine, how to navigate the regulatory world around antimicrobial use and antimicrobial stewardship, and really understand once you got a disease, what can we do to treat it and manage that. And then we also offer what we call SMEC 478C, our swine emerging diseases and emergency response management rotation. And so this is the rotation I lead, where we are focused on foreign animal disease preparedness and response. So things like African swine fever, foot and mouth disease. We work really closely with the National Pork Board during this rotation to offer a foreign animal disease tabletop exercise. We just held one of those back in April, where we kind of run a tabletop exercise or a drill with if a foreign animal disease was introduced into this town that's built on this tabletop, what would the response look like? In addition to foreign animal disease, though, we just talk in general about emergency response and disease management. So if you have something like a livestock trailer rollover, how do you respond to that? If you have a mycoplasma pneumonia issue within your herd, how can you go about eliminating that disease and managing that disease? So those are our formal course offerings that we have. We also offer content to other veterinary schools across the country. So this is a list of our collaborating schools. You can see there's 8 of them listed here. So Mississippi State, University of Wisconsin, University of Tennessee, Northeast Iowa Community College, Auburn, Long Island University, and Rowan University, and the University of Nebraska-Lincoln. So we collaborate with these schools and provide some, if not all, of the swine content to those students at those schools. And so most of those are veterinary students. The Northeast Iowa Community College students, those are students that are in a vet tech program at that college, and they'll actually be here next week for a full week of on-farm training and clinical skills to hopefully help build their skill set where they could go in and work with a integrator or a large animal practice that's going to work with swine, and they'll feel comfortable with that coming out. So we not only serve the Iowa State students here and folks within the state of Iowa, but we also serve nationally and internationally by providing those swine education opportunities. We also have some other just kind of ad hoc custom trainings that we develop. So we have a certified swine sample collector training program, which I'll talk a little bit more about next in the SMEC Smart portion of the discussion. But we provide on-farm trainings to certified samplers. We've done that through the ISU Extension and trained those Extension veterinarians. We also have a Pig Pros, which is a swine production medicine perspective for non-veterinarian professionals. So you go over and spend 3 days in the AMVC system, learn the ins and outs kind of production, all the inputs, what it costs to produce pigs. So it's a really short course to immerse those non-veterinary individuals into the industry. Like I talked about, we have livestock truck rollover emergency trainings that we incorporate into our 478C rotation, and we provide that in conjunction with the Iowa Pork Producers Association. We've delivered lectures to a group in Ukraine that wanted to learn more about pig production due to some issues that happened over there in the war. Dr. Doughan actually leads the care for the sows and the piglets at the farrowing display at the Animal Learning Center at the Iowa State Fair. We host the SHIC webinars, which some of you may have watched. on new and emerging diseases that might be coming around. And then we also pretty routinely get calls from producers or other veterinarians within Iowa and across the country that just want us to consult and get our input on the cases that they have for their pigs. So those are all services that we offer to our constituents here nationally. So SMEC Smart, like I've talked about, is our swine medicine applied research team. And so these are just a few examples of some research projects that we've been working on. And so we're over 50 projects now since the inception of SMEC Smart a couple of years ago. And so SMEC Smart 19 was a project that I actually worked with Dr. Rademacher on in terms of sow mortality. So looking at ways that we could try to improve sow mortality within a farm. And so you might have heard Dr. Rademacher or I present on this before, but we're able to go into a farm and decrease mortality, sow mortality by about 4.25% annualized mortality within that herd due to some methods we developed on that project. Project 21, I'm not really going to touch on. I'm not going to steal Dr. Dawn's thunder on her project there. She's going to talk to you in depth about that here in just a few minutes. 27 is the Certified Swine Sample Collector Program. So the CSFC program that some of you may be familiar with. We were integral in developing that program along with the American Association of Swine Veterinarians, National Pork Board, the Center for Food Security and Public Health, and the Multi-State Partnership for Security and Agriculture through some NADPREP funds. We were able to secure funding to develop this training program to train on-farm personnel to appropriately sample pigs in the face of a foreign animal disease outbreak. And then Project 31 is Dr. Meredith Peterson, who was a former postdoc here with SMEC. She is now a director of swine health at the National Pork Board, but she was working on telehealth methods and validation of telehealth and virtual connections for swine farms to be able to further extend ourselves and provide care via virtual connections to farm. And so kind of our rule of thumb that we like to live by here at SMEC is to be useful. So all of our research that we focus on is very applied, that can be used out in the field. Through the telehealth project that Dr. Peterson was working on, our goal was really, can we get any set of eyes on any set of pigs anywhere in Iowa within an hour? And so still trying to work on those techniques and validate those. But also through that, like I talked about earlier, we try to capture all these opportunities through our research to be able to improve our teaching efficiency and our teaching methods. So these virtual connections help us increase our teaching efficiency and increase our surge capacity for FAD outbreaks and also improve veterinary medicine access. And then just briefly want to talk about our postdoc positions that Dr. Daughan is currently in. So those are positions that we provide to veterinary graduates. And so through that, they could come into this postdoc position, pursue a master's and or a PhD and or board certification through this program, working on an applied research project. They would also do some clinical teaching and get to really work in some advanced practice areas to really form those triple threat graduates that come out of our department. Like I said, SMEC is not a brick and mortar building though, and so we would not be the organization that we are today without the collaboration across the industry. So our resources account for about 52% of the pigs in the United States that we've worked with at some point in SMEC's lifetime. SMEC's a little over 10 years old at this point. And so we've had a large impact on the industry through all of these connections, and we're very grateful for all of those connections. Like I mentioned at the beginning, that QR code, which you see here again, will take you to our link tree. That'll take you to our website where you can learn more about it. But one thing I really want to point out to you is our SMEC daily question, or the SMEC Learn daily question there. You can sign up for that. And what that is a email that you will receive every weekday, Monday through Friday. And then it's a multiple choice question. So you click here, like you see on the screen there. It would take you to a multiple choice question related to pigs. It's not all veterinary related. Some of it is swine medicine. Some of it is just production. Some of it's breed specific. So it's just a multiple choice question to kind of quiz you on your swine knowledge. And then you get immediate feedback on if you got that correct or not. For those of you that are curious, we cannot track your score, though, if you get those correct or incorrect, nor do we want to. So don't worry that we're keeping a tally in the background. What we really want is just to expose as many people as possible to those swine questions and that swine knowledge. We also are on social media, so feel free to give us a follow there at ISU SMEC on Instagram and or Facebook, where we post a lot of our current research projects that we're working on, current trainings that we're having, different information. We'll have a lot of information coming up about the pigs leading up to the state fair here in a couple weeks. So feel free to give us a follow on our social media. And then the last thing I'd like to leave you with, and then I'll turn it over to Dr. Doughan, is kind of our impact on human health as swine veterinarians and why we are committed to training the next generation of swine veterinarians and individuals that are integrated into swine production and the swine industry. So if you have a pig barn, and we just have some assumptions here of about 1,200 pigs in that barn that weigh about 285 pounds at market, and we're going to get a 73% carcass yield on those. And we're going to say that each serving of pork is about 8 ounces. Really think recommendations are about half of that, but we all kind of love bacon and pork chops, so we doubled it and made it 8 ounces per serving. What that barn of pigs equates to is right at about 500,000 meals, or 500,000 meals per turn of pigs through that barn. So think about 2 turns of pigs through a barn in a year. You're going to have about 1 million meals that come out of that barn, and about 30% of those are going to be exported. Okay, so we really have an impact not only here domestically but also internationally on the health and well-being of individuals by producing a wholesome product. So every decision that we make in terms of treatment, prevention, management has a global impact on human health and well-being. So just wanted to leave you with that little tidbit. And now I will turn it over to Dr. Doughan.
Awesome. Thank you, Justin. And thanks, Dr. Rademacher, for the opportunity to speak today. Today, I'm going to be discussing most of my PhD research, which is on this topic of waterline biology and things that we've seen in the field after a one-time disinfectant was applied, and its kind of impacts on water quality and waterline biofilms. You want to advance, please? So the objectives I'm going to go over today is just introduce a little bit of background on this topic of waterline biology, and then discuss some impacts on what waterline biology has on some of our treatment mechanisms, whether that's our medications or our oral vaccines, and then share some updated research results from my PhD project, and then also discuss how can we put this all together and create some interventions to make an impact that ultimately impacts the pig. If you want to advance, please. So why does waterline biology matter? And so a lot of the previous research has been quite dated and has looked at nutrient value of water quality. So looking at trace minerals, how it could potentially impact pigs' performance and health. And generally from those results, we found that, they tend to tolerate a wide range of water qualities, and especially those older pigs aren't as affected by it. However, some of those other pigs, the nursery age pigs, they can be more susceptible to those water quality changes. And so if you want to advance, please. It's led to some assumptions that pigs can drink out of mud holes and streams, if you want to advance. and they can tolerate those different water qualities, and we don't need to assess water quality in general further. However, there's been some more recent research, if you want to advance, yep, thanks, on water treatment and decreased sow mortality due to pelvic organ prolapse, with those water treatments, indicating that there may be something going on with the water or the water distribution system that could have those impacts. We also have documented evidence of presence of waterborne human and livestock pathogens in different water sources. And, there's anecdotal evidence of, improvement of E. coli cases with water treatment or shocking well. And then ultimately, we are a little bit more concerned as we're learning more about biofilms, and, we are administering medications into these water distribution systems. And how could that ultimately impact antimicrobial resistance? So the main two things that I want to really touch on today are, our impacts on waterline biology through biosecurity, and then also how can we increase our water treatment medications and those efficacies so that we can have an impact on the pig. You want to advance? Thanks. So when looking at waterline biology as a risk, we need to start with the water source. And so that's what's coming into the farm. If we've got, that could be surface water or well water or even municipal water. And in those cases, we may not need to be as concerned about municipal water because that is a treated water source. However, with surface water and groundwater, as we're learning, is that contaminants can actually go through these macropores and very rapidly reach from the surface to really deep depths. On the human side, they found viruses that have been about 300 meters deep. So we're not just talking about superficial wells, but we're talking about, very deep wells in some locations, maybe more susceptible to pathogen entrance. And then also water has some favored, conditions that allow pathogens to maintain their infectivity and their viability. And so the temperature is ambient. We don't have that UV light exposure, to inactivate pathogens. And there's some other special properties that really help preserve those. So we have a rapid method of transport, from the surface, whether that's from manure application or a mismanaged compost pile. And then it's getting into the water source. So it should be considered a biosecurity risk. When looking at general prevalences, how often could this be happening? The DNR had surveyed Iowa wells over a 15-year period, and roughly 40% of those contain fecal coliform bacteria. So that doesn't necessarily mean that it's a problem or that there are pathogens directly in there, but it indicates that fecal contamination could have occurred, and the conditions are right that those coliforms are surviving there, and therefore pathogens could also live in those conditions. Additionally, across the entire US, it's estimated about 30% of wells contain viruses. So that was really done from the human side with rotavirus and other enteroviruses. And so I think it's important that, when we consider our livestock species, I think that, there's definitely a risk there. If you want to advance, please. So once we get inside of the barn, there's also some other dynamics that can also contribute to the degradation of water quality. And so the first is coming from the water distribution system itself. So these systems are open, they're dead end, meaning that they're not circulating. And so any debris or pathogen entrance from the stock bucket, potentially the pigs themselves, filters, medicators, etc. All of that can contribute to biofilm development and potential debris that gets into the water lines. And so dead ends, all that debris kind of builds up at the end, which is a really good seeding point for additional biofilms, and then also can cause some, potential restrictions on water access and all of that as well. Our systems are also medicated, so we can also favor biofilm development through, administering our vitamins, our probiotics, our live attenuated oral vaccines. We're actually introducing bacteria into these water distribution systems. And so there's a lot of different dynamics that need to be studied and investigated to further understand, what impacts those have. Water quality, our farms tend to have hard water, high iron content, and then also with an elevated pH, that mineral will actually adhere to the inside of those water lines, creating a rough surface for if we have a pathogen or any organism into the system, it can cause biofilm development that way. So ultimately, these waterline biofilms may have an impact on our treatments and can also cause problems with water restriction in our farms. If you want to advance, please. And so how can this potentially reduce waterline treatment efficacy? Well, the water distribution system design and management itself, the water medicator and maintenance out of the box, water medicators can have, an estimated plus or minus 30%, of what the dosing efficacy, is. And then also just over time, those different types of medicators can break down, and then the dosing even becomes even more incorrect. And so we, just can have some issues with that, and then also contributing to antimicrobial resistance with those improper dosages being administered. Dirty stock buckets, like I had mentioned, can be a pathogen entrance source, and then can also inactivate other types of, so if you're administering an oral vaccine and then you're running citric acid out of the same stock bucket, those two things can inactivate, one another. We also have improper stock solution formulations is a common, occurrence, and then low water pressure too. That is a useful thing for biofilms to develop. That stagnant water or low water pressure can also cause some water restrictions too to the end of the barn. Additionally, we have some decreased efficacy through water quality and other water treatment mechanisms. Maybe we're applying water treatment and also applying it at the same time as some of our preventative mechanisms or treatments, such as like antimicrobials. However, the pH of water, the water hardness, other trace minerals could potentially cause some interactions with some of these treatments. And so, again, need to have more, investigated so that we can try to understand those dynamics and how they may influence one another. Antimicrobial residues can also be a problem, as some of these, drugs may precipitate out. And so it's also another potential concern that needs to be looked into, is if water lines are actually, are there residues of antimicrobials in water lines due to that? And then also some antimicrobial resistance in biofilms. We know through some pilot data that we've previously reported on that antimicrobial resistance genes are in water lines, and just knowing biofilms and kind of how they operate, they can actually accumulate drugs and other minerals into their extra polymetric substance, or that slime layer that is helpful to protect them, further exposing them to drugs consistently and contributing to antimicrobial resistance. And then we've also found that these genes have been linked to drugs that we use and don't use in swine medicine. So, we're seeing multiple drug resistances, due to this. So if you want to advance to the next slide, please. So I want to discuss the project in a little bit more depth and some of the objectives that we were looking for. So like I had mentioned, it was a one-time disinfectant event that we put when pigs were not in the barn. So we wanted to understand the rate of biofilm regrowth, and we did that through standard plate counts, both aerobic and anaerobic, to get a quantitative measurement of how much biofilm was in the lines. We also wanted to identify the biofilm composition, and so we were looking at bacterial components through 16S, and then also some bacterial, even in more detail, and virus components through shotgun sequencing. We wanted to assess the relationship of water quality and biofilms through testing the water for trace mineral, water quality, coliform, and pH. And then we also created these drug-infused culture plates with CTC and then some separate lincomycin plates as well to determine, we know that there's genes there, but are those organisms actually expressing that phenotypically? So are they using those genes, to be resistant to those antimicrobials? If you want to advance, please. So the methods and how we and what we did, we used a cleaner and disinfectant. It's peracetic acid, and we used it at a 1 to 128 dilution. And we charged the water lines and let that sit for 24 hours. This product is labeled for descaling minerals and kills and removes biofilm. I would like to mention that this was an off-label use of this particular product. It was labeled at a 1 to 50 or a 2% dilution. We've thought that since most producers have a 1 to 128 ratio, this might be, how producers may apply this product on the farm and maybe most applicable. So as we go on later, some of those results may have been affected by that. And looking back, I'd probably would have done it at that 2% dose. Our sample collection, we used 6 wean to finish sites that were in central Iowa on well water. And we took 10 sample collections throughout a 77-day period. So before we administered, during the pre-treatment, after the water lines had been charged for 24 hours and then flushed, we collected at that, that's at time point 1. And then day 3, 5, all the way to 77 days post, treatment or disinfection. And at each time point, we collected water and water line samples, and those were collected aseptically. If you want to advance, please. And so going over some preliminary results, and next. So looking at water coliform and E. coli preliminary results, when looking at total coliform count, here in the left-hand graph, I'm looking at average total coliforms in rooms versus wells, and this was across all 6 sites. So these are averages of the rooms across all 6 sites and averages across the wells over all 6 sites. So if we look, we can see that the coliform counts are actually higher than what is actually coming through the well. And so, if we're just sampling water at the well and we're not sampling water at the rooms, we're getting 2 very different water quality measurements here. So the water quality is decreasing as, we get into the barn, and that's through the influence of the water distribution systems and those biofilms. I would like to point out too that the averages did decrease after that, after the disinfection event, so after that 24 hours. And then we see that increase at day 3 all the way, to day 77. And I think part of the reason of that is, we had removed the biofilm in a lot of cases, and then the biofilm was regrowing. And we had removed any mineral deposits in there, so it could have been shedding potentially more into the water itself. Then if we look at average E. coli in rooms versus wells, I had to break this out a little bit different. So you can see the rooms is the blue line kind of in the middle there. This was very sporadic when we saw E. coli come in. However, there was one site that was really driving up the average, and that was site 5. And we'll revisit this in some of our other results later. And so in conclusion, we need to sample from multiple locations. And I just want to remind you, coliforms are not very well understood, and so we may have more impact on younger pigs versus an older pig. Still needs to have more research there. And ultimately, those coliforms serve as an indicator for those livability conditions for particular pathogens. And so that's why that is important. If you want to advance. So these are our standard plate count results. So these are the quantitative measurements of biofilms and water lines. So we sampled from 2 different rooms. So you'll notice some north and south and east and west here, as well as north aerobic and anaerobic values. Those tended to correlate with one another pretty well because the organisms, as we found out, they tend to overlap one another in those growing conditions. However, what I want to point out is that the biofilm is growing and active 3 days, after that disinfection event. And then we are seeing some room differences. So if you look at the bottom right graph at site 6, we can see that the west room had been decreased, for days 14, 21 through 56, versus the east room remained elevated. We can also see some differences just in biofilm loads between the sites. So if you want to advance to the next slide. We can see that we had anywhere from 0 colony forming units per mil, so after that disinfection event, all the way to 3.3 billion colony forming units per mil. So pretty significant biofilm loads at some of these sites. You want to advance? So talking about the phenotypic resistance plates, so these are those plates that we had created to inoculate and put biofilm organisms from the waterline samples that we created to try to determine if the organisms were resistant to CTC or lincomycin. And so, you know, we were distinguishing acquired resistance versus intrinsic. So we wanted to look at, you know, what was the spectrum of the drug, and, you know, if that bug fell under the spectrum of that particular drug, and it should be, you know, the treatment should work for that, should kill it off. And then if that particular organism grows, then that would be acquired resistance versus, you know, the spectrum didn't cover that particular bug, and then it grew anyway. So we found 112 unique organisms throughout the entire study. 104 of them were bacteria, and we weren't selecting for yeast or fungus, but we ended up growing them. So we found 5 different yeast species and then 3 fungi species there, if we want to advance. We also found some known pig pathogens, Staphylococcus and a hemolytic F18 E. coli, which I'll talk about in a bit. And then we had lots of opportunistic pathogens within these samples that showed, that demonstrated resistance. And then also some organisms in normal flora, you know, that we find in the respiratory, vaginal, and intestinal tract of swine. And we also have some NGS results pending. And so ultimately, hopefully we're going to add to this list of organisms that we've identified, but those are still in the works right now. If you want to advance, please. So I wanted to talk a little bit more about this E. coli that we isolated on those phenotypic plates. This, not surprisingly, was found at site 5. So if you remember back to that E. coli chart within the water samples, so this was at that site. So we isolated an E. coli on a CTC plate on day 5. And it had an F18 pilus, a PAA adhesion gene, an yeast-1 toxin gene. And we had confirmed that this was not an oral vaccine used by the collaborator. On day 7, we found the same genetic profile, E. coli, you know, and some other characteristics too. And then it had grown on a CTC and lincomycin plate. We did not grow an E. coli on this day 14 date. However, we did grow a separate E. coli on a CTC plate. It was hemolytic. It had a PAA adhesion gene with no fimbrial or toxin genes. So it was probably not likely an E. coli that would cause disease in pigs. However, you know, in general, we did find a hemolytic E. coli that could potentially cause disease in pigs with resistances to drugs that we commonly use in water meds. So if you want to advance, please. And then again. So how can we wrap this all together and have an impact on pig livability and health through waterline biology? The first kind of main takeaway is to monitor water quality. And we need to take samples from multiple areas within the farm. So we need to sample the well. We need to understand what's coming in through the water source. We also need to understand what's going on within the rooms, because we know that water quality can diminish once we're in the rooms just from those biofilms. Recommended testing, you know, it'll really depend on resources and other things that are available. However, you know, I recommend to test at decision points. So using the water quality in between turns, or to determine what chemistry or management strategy may be needed so that you can make those adjustments is what I would recommend. The second piece is to clean water lines. So we know that biofilms are present in water lines and that they have a quick biofilm regrowth rate. And so a continual disinfectant may be needed. So a terminal or a one-time line cleaning, and then also using a continual disinfectant may be warranted. We also want to target the chemistry to remove both the mineral deposits and biology components of that so that we can completely eliminate biofilms. If you're just removing the biology component, it may grow back, or you may not completely eliminate it. And then making sure that those chemistries that we are applying are working. And then, you know, flushing those dead ends. Debris can accumulate over time. So, you know, the poultry industry flushes them fairly routinely. And I think some research needs to be done to understand, you know, could that be a benefit to the swine industry? The third is to maintain water treatment efficacy. So this means cleaning stock buckets, you know, or having designated stock buckets for different treatments. So for example, you know, a vaccine specific bucket, an antimicrobial specific bucket, or you could just simply use a trash can liner in between these treatments to make sure that we're, you know, we're not adding anything into the system or inactivating the product that we're using. cleaning and maintaining medicators for the same, purpose as the stock buckets, trying to eliminate biofilms and inputs into the system. And ultimately, we need more research on this, but running medications and waterline biocides, so those chemistries, those treatments, is not recommended just because there are, in the minimal research out there, it shows that some antimicrobials may be inactivated or not as soluble as we would like them to be. So not recommended at that time. And also just stabilizing your oral vaccine. So maybe if you are using municipal water that does have chlorine in it, that could inactivate those vaccines, and just making sure that we are getting the use out of the treatments that we are applying already currently. So if you want to advance. So there's a lot of people I want to thank. Last summer was a lot of cleaning out water nipples and getting sprayed with water all the time. So really appreciate the SMEC's effort, with that, the SMEC team, and then our work study students as well. And then ultimately those at the diagnostic lab who are helping, and then obviously our collaborators and producers who allowed us to do this project. So if you want to advance. Now I think it's probably some time for some questions, maybe.
Yes, thank you very much, both Justin and Gabby, for your excellent presentations. Again, any of our live attendees, if there's a question that you would like to ask, I just ask you to please drop it into the chat feature and we'll go ahead and read them off. I do have a couple of questions here that I'll go ahead and ask of our participants. First one is for Justin. You mentioned a little bit about some research that you were doing in telemedicine. Can you kind of give us a short overview of what you've learned about that so far, and if that is something that may be used in the future?
Yeah, for sure. So like I mentioned, Dr. Meredith Peterson, that was her PhD project to kind of work on validation of telehealth methods for swine medicine. We've learned a lot through her research, but there's still a lot yet to be determined. So as most of you are aware, not everywhere, especially pig barns, have good service to actually connect, right? Where you can get good streaming video. So we work with a company that's called Distinct here in the ISU Research Park to try to help with some of those connection techniques. The original concept was kind of setting up an antenna outside of the barn with some tractor batteries set up on a table or across a piece of plywood on some sawhorses. And then you ran a line into the barn to try to get a little bit better signal. And that since has advanced to a small kind of handheld device that boosts the cellular signal within the barn to try to help with connectivity there. But there's still connectivity issues even with those devices, right? We found that connectivity varies within a day, and it's not consistent day to day. From it's better in the morning or better in the evening. It seems like there's a lot of variables that affect connectivity as well. And then also there's some limitations to the technology that can be used. We've tried out using cell phones with cameras and just using Zoom or FaceTime or similar software or apps to those, to these wearable kind of heads up displays, head cameras. And what we found is there's variation in the color that gets transmitted because everything has to be condensed down to be transmitted across the airwaves, right? And then unpackaged and presented to you on the screen as a picture, just like today, like we're doing on this webinar. And so when you're on farm, not all of that content may or may not come across. So we ran into some issues where pigs on a farm were marked with treatment marks, but an evaluator sitting in an office like I am today could not identify the treatment marks on those pigs because those colors didn't come across. So is there, I guess to get to the root of your question, Dr. Rademacher, is there a place for telemedicine in swine medicine and swine production? Yes, I think there is. but we've got to overcome some technical limitations in the future. And so I think it's a useful tool that can be used, and we're currently working on some more research in that realm to try to see where it can and or where it should and maybe shouldn't be used at the moment. But I think with further advancements in technology, which will come, that it'll just continue to improve the accessibility and use of those technologies to evaluate pigs.
Yeah, fantastic, Dr. Brown. That's a great overview. Dr. Doughan, really interesting information. So one question I know I was thinking of as you were presenting, what do we know about the potential risk of PRRS getting into groundwater and potentially serving as a source of infection into new sites?
Yeah, that's a great question. So we're actually doing some research right now. It is my master's research looking at the risk of PRRS and some other swine endemic diseases coming through groundwater, to try to put some numbers on the swine side so that we can understand that better. But really what we're doing is we are collecting about 200 gallons of water and running it through a filter from the well. So it is a special filter. It's a kidney dialysis filter. And then we're going to test that for PCR. So there's to be determined on that. But as far as the risk side, I still think that it's likely that we're going to see some swine pathogens, in this study turn positive. And some of these we know from the limited human studies and some crossover with some livestock that avian influenza has been detected on poultry farms in some of the wells that had tested positive for high path avian influenza back in 2015. There's also been some research on surface water. They've detected porcine hepatitis E virus. So we know that there's some porcine viruses and potential zoonotic viruses also kind of working their way through the system. So, and then ultimately getting to wells that may supply farms. So ultimately we're trying to figure out if PRRS is one of those and PED and circovirus. So we're trying to look at that.
Very good. Dr. Brown, just kind of curious, and do you see there being the potential for maybe some future opportunities for external CE opportunities or distance learning, maybe for field veterinarians or even maybe for producers through SMEC, and what that mechanism might eventually look like?
Yeah, I think so. So we're always looking for opportunities to train more people. It's our bread and butter, right? And what we love to do. So external clients can come and take the courses that we offer, either those clinical rotations or that Pig Pros. We hopefully in the future will be holding more CSSC certified collector trainings as well. And so those will be open to external clients. And then I would say if any of you have a specific need for a training, we'd be happy to discuss that with you as well, and how we might could help fill in that need for you there. So we also have a, we call it SMEC Plus. It's our digital repository of all those clinical skills and techniques and cases that we've compiled over the year. There's over 130 different videos and techniques and tutorials within that resource. That's something that you or someone you know would be interested in. We could have that discussion about how to get you access to that as well.
Perfect. The last question for Dr. Doughan. I was kind of curious by some of the pathogenic E. coli that you found in the water lines. What do you think, or have you looked at all about where you think that may have come from? Is it coming from the well or backflush coming through the pig nipples or the pig waters? What do you think there? What have you learned?
Yeah, I think that's a great question. I'm not quite sure where it came from. There was a little bit of E. coli that was coming through the well at that particular site, but we are seeing it mostly in the rooms. So I think it's it's probable that the pigs are introducing it, in between, into the water system itself. But where we were sampling is up on the ceiling. So this wasn't like close to a water nipple. We really collected those samples very carefully because we didn't want any environmental contamination with that. And we also found some other organisms like Staphylococcus, some vaginal microbiome, respiratory, etc. So I'm not really sure where those organisms are coming from, but I think as from what I know right now, it might be difficult to introduce all of those organisms just from the well itself. So I think that there's definitely some input from the pigs, but it does need to be investigated further.
Very good. We did have one question come in on the chat line for you, Dr. Doughan, wondering if there was any studies in the pipeline to potentially correlate water treatments and improved water consumption during either late gestation and early farrowing, and to see if that has any potential impact on sow prolapses.
That is a great idea. There's a lot of different water topics that I would love to dive into and study, because it's kind of a wide open field. We haven't really looked into water quality or water problems really, or waterline biofilms. And so I think there's lots of opportunity for studies, and yeah, I would totally be game for something like that.
All right, very good. All right, well, our sincerest thank you to both Dr. Justin Brown and Dr. Gabi Doughan for their excellent presentations today. Thank you for your attendance as well. We will go ahead and plan on another webinar next month. Stay tuned for more announcements on that. You can always check out this recording or any of the past recordings on the Iowa Pork Industry Center website at www.ipic.iastate.edu. Everyone, please have a wonderful and safe day. Goodbye.
Thanks, everybody.
Thank you.